Hello and welcome back to the Carson County Memorial Hospital Connection podcast. Thank you for joining us again. Before we jump into it, I just want to remind you guys that this is February and it is Heart Health Month. So make sure you check in with your primary care provider to see if you need any extra screenings like calcium scoring or maybe echocardiogram, which we offer both of here at KCCMH. So be good to your heart this February. Well, all the time, but especially in February, right?
Yep. Yes.
So today on our show, we have a guest that many of you probably know from many different capacities across the county. But today we are going to be introducing her in her new role at KCCMH as the director of the KCCMH Foundation. So Kindra, welcome. So please introduce yourself and share what brought you really to KCCMH and then into this new role.
Okay. I am Kindra Mulch. I am the director of the Carson County Memorial Hospital Foundation. Through the years, I've held a number of titles, all on behalf of Carson County. In an old life, I worked at Health and Human Services, and upon my retirement from there after 35 years, I had the opportunity to become nurse here at the hospital. And through that period of time that included COVID and a whole number of different activities and needs, and I filled a number of roles here at the hospital. I am passionate about this hospital and always have been passionate about our health service district and all the services that we provide through the district. I got in this role because of discussions with our CEO, Brian Bogle, and Brian was very interested from the time he arrived here about us having a foundation. He wanted a foundation for the hospital. In his previous experiences, there had always been a foundation that benefited the hospital. And I, too, have been interested about a foundation for our hospital for a very long time. Our hospital was founded on the principles of philanthropic efforts, and it was time in our evolution to formalize that philanthropy. And we can go into more detail about the advantages if you'd like to.
Yeah. So why is it important for KCCMH to establish a hospital foundation at this time?
So Carson County Memorial Hospital is organized as a special district, Kit Carson County Health Service District. And the district owns the hospital and clinics and is responsible for all those services. And that was established in the 90s that we became a hospital district. We're a form of local government. And as such, our governance structure requires the hospital district to establish and approve a budget on an annual basis, and that budget has to be noticed to the public and an opportunity for a public hearing. And there are a number of stewardship responsibilities that local governments have to go through in order to appropriate and spend government funds. And all of our funds, our expenditures are predicated on those rules. In a philanthropic situation, you might have people that want to donate for a very specific cause. So under the government structure, one can donate to that specific cause, but it can't be promised that that's how it will be spent until the board of directors determines that those dollars can be used for such a purpose, and then through the public hearing process, people have to be noticed that that's how those funds are going to be spent.
So it's a really complicated process.
It's a very complicated process, and promising how one would spend money in a government structure is different than how one can function in a nonprofit. So as a nonprofit, Kit Carson County Memorial Hospital Foundation can receive designated funds at any time of the year. There is a board of trustees for the foundation. They work in relationship to the donor, and I'm kind of the in-between person, so that we can assure that donations are made, our donations are spent in the manner in which the donor requests.
Because we do have some very specific requests, right? Like I know a family that went through Comfort Care and they wanted their donation to go back into that program.
Correct. So in a scenario that we existed in the past, we The district has been very responsible stewards of those donations. It was not required of them, though. And had there been use of those funds in ways that maybe weren't for end-of-life care, there would be no recourse for that. And so, again, that's what Brian wanted to provide assurance to our community, that when they made donations, they can choose to be unrestricted, or they can choose to be specific.
That's wonderful. So can you tell us a little bit about what the mission of the foundation is and what your top priorities are in your first year?
Okay. Our foundation is solely for the benefit of Kit Carson County Health Service District and hospital and the work of the hospital. So every penny we raise and every penny we spend will be spent in accordance with the needs of the hospital. So it'll be a collaborative effort between the hospital board and their administration and the foundation trustees. And honestly, at this time, we are organized in such a fashion that as the director for the foundation, I am employed by the hospital district. So there's real close communication between the trustees and the board of directors and the hospital leadership.
And do you think still being an employee of the health service district gives you a unique perspective on understanding the needs of the district?
I do. And that model that we are using, we have actually looked at best practices across the country and within our own state. And the model that we are using right now is just what I've described. The foundation director is an employee of the hospital in places and other critical access hospitals and actually other private hospitals in our state.
And I know that your role is extra unique because you don't only work as the director. I know you're still doing some home health care and other nursing duties.
I do. I have a unique opportunity to engage with my colleagues, and in those endeavors, whether it's working over at Park Health or here in the hospital, I get to see firsthand what patients' needs are and what staff needs are.
I think that's very cool because a lot of times in all organizations, the administration can somewhat be disconnected from the needs of the employees. So I think you are in a very cool situation. So can you tell me, how do you think the foundation will support the long-term needs of our rural hospital and community?
So philanthropy is how we were founded. It's how we built this facility. It's how we've purchased equipment through the years.
Let's pause right there. If I'm remembering my KCCMH history correctly, it was farmers donating bushels of wheat.
Yes, that was a part of the funding for the hospital. There were also donations of land. There was many hours of donations of labor. And then there were other financial contributions for those individuals who weren't in a situation where they could donate wheat, which was the primary crop donation back in the beginning. Yes.
Okay, so we are literally built on the philanthropy of the community.
Yes, we are. Yes, we are. There was an identified need in the 30s and then the 40s. Our people in our community recognized that if they wanted a hospital, they were going to have to build it. Prior to that, there were private doctors in our county that had little hospitals of their own. So I want to be clear that there were hospitals, but they were run by a physician. And as healthcare was evolving, it became more costly and difficult for a physician to run a hospital and run his practice. So the doctors in the county at the time supported the development of a hospital that would have its own structure and own financing, and they would work. They'd put their patients in this hospital.
Okay. I think it's really very fun to think about that. Anybody that's been in need in our county recognizes that we have a very generous county, a very generous population, not only with money, but, meal trains and just positive support. And so I think it's very neat that you're trying to continue that legacy through the KCCMH Foundation.
Philanthropic efforts are foundational in our culture. We are a culture that appreciates and expresses our appreciation and our gratitude, and that's what I'm really trying to cultivate, is an opportunity for those in our community. And sometimes donors live right here in your community, and sometimes donors are passing through, or donors have generated income off of this county and want to give back. They might be absent landlords, for example, but they want to express their gratitude and appreciation for the rural ag community that we have, and the opportunity to give financially, of course, is there, as well as to donate time and effort and goods.
Yeah. So you touched on the idea of people being able to donate directly to a cause. Let's just say somebody wants to donate to the foundation. What kind of projects will those dollars potentially be funding?
So
I'm just going to scoot that closer to you.
Sure. So the primary work that we're doing right now is in our scholarship program. And I'm wanting to really get that information out there. So thank you for asking that question. Our scholarship programs are going to be diverse over time. Our trustees have expressed that they want to certainly offer traditional scholarships, such as to high school graduates, but they want to be really clear that we're also looking for post-secondary candidates as well. People that want to work in healthcare, that need advanced education, formal education, or certifications or licensure. Our scholarships will complement the scholarships that are already in our community for those purposes. So I do want to be clear that we want to work collaboratively within our community around those financial opportunities. But the end goal is to get people to the point that they can fill critical positions here at our hospital, and or their employees who want to advance or change their trajectory but need education or certifications to work at a different department here.
So do you want to tell us a little bit more about the scholarship? It's almost ready to launch, correct?
Yes, the application for scholarships will be going out to high school counselors in our community, and we'll have it on our website, and we're going to be encouraging people to take a look at that application. If they've got questions, we want them to there's a phone number that will be listed for them to call, and you can always call the hospital's main number and ask for the foundation. But it will be launched very soon. The deadline for submission of the application will be March 31st.
And how many scholarships are you awarding, and what is the award amount?
So we're going to start with 6 scholarships at $2,000 apiece, and hopefully that grows. Our goal is to increase that as we go throughout the year and over the years. And initially, our scholarship program will be 1-year scholarships, but the trustees are going to look at a model for continuing scholarships for those individuals that may be in their 2nd or 3rd or 4th or 5th year of education.
Oh, that's wonderful.
Yes.
So right now we know that to apply for the scholarship, you can be a graduating high school senior. You can be a person already in healthcare looking to advance your position, or you can be someone seeking a second career or changing career that is driving you towards healthcare. Those people can apply too?
Yes.
I love that.
All of the above. Yes.
I love that. I feel like that's so many opportunities to continue growing our own.
Yes. And you hit on that very important point, and I want to reinforce that. Growing our own is something that we all have known intuitively. Through our experiences, we know that people who grow up here are going to more likely come back here and or stay here to practice and to live. So offering that financial opportunities to solve those financial barriers, that's what we want to do.
That's wonderful. So how can community members get involved or contribute in the foundation's work?
So you can contact me here at the hospital, and we can have a discussion about whether you want to have a designated purpose for your donations or whether you want them to be undesignated and to be used however you choose. We will account for those donations. We will, of course, give a receipt to the donor, but we will also, upon their request, if they want to know how their monies are spent, we will let them know when those dollars are spent and what was purchased. And I think it's that fiduciary responsibility that is really grounded in our community as well. People tend to want to know what their money is used for and to know whether it was used in the way that they wanted it to be spent.
Yeah, I do know that financial transparency is very important. I think it's kind of a value in our community.
It absolutely is.
People are willing to give their money as long as they know it's being spent appropriately.
Exactly.
Let's see, what else can we talk about? So let's say that I want to contribute to the foundation, but I don't have any money to give. Will there be any events or any opportunities for me to give my time?
So we will be planning events. At this time, the exact nature of those events and the timing of those are still in development. But yes, there absolutely will be. We assign a dollar value to all sorts of activities, and volunteering is something that we can use in our philanthropy to assign a dollar value to. There are funders out there that may fund specific projects for our hospital, and they want matching contributions. You can use a certain portion of that match in volunteer hours.
Wow.
So yes, that's why we will also, in the volunteer program here at the hospital, it's one of the reasons why we also collect volunteer hours.
Gotcha. So can you tell me why philanthropy is especially important in a rural hospital like ours? And I know you've touched on it, but can you just really drive home why it's very important that we have donors?
Our funding at a critical access hospital, such as Kit Carson County Memorial Hospital, is really a cost-based reimbursement system. There is not really opportunity in a cost-based reimbursement to bill for all. You can't include all your expenses. You cannot include all your educational expenses. You cannot include all of your equipment expenses. You can include quite a few of them, but not 100% of them. For facilities development, you can include cost of the facility for operations, but not for building.
Mm-hmm.
So the opportunity for philanthropic giving gives us the competitive advantage to have some dollars towards our projects. Then when we're out looking for other financing mechanisms and options, such as grants and even loans, even USDA loans, they want to know, what is the community contributing? Same way with DOLA loans, what's the buy-in from the community? And so I would like to catch on something that I looked into when I started this, because the hospital, as a special district, we do get a little bit of a mill is assigned, 3 mills are assigned to our hospital, which generates in the neighborhood of, I don't know, I think, don't quote me, and here I am on being recorded, but somewhere in the neighborhood of $700,000 a year. That mill levy does come to the hospital and to spend. It has to be appropriated and spent according to the budget process. But that's the only money that the hospital really gets that's unrestricted. And that's not very much. That's not very much unrestricted to run an organization the size of Kit Carson County Memorial Hospital.
Mm-hmm. So we're back to this point, is that the funding of a hospital is very complicated because we have a mixture of payer sources like insurance or Medicaid, Medicare, uninsured persons that we take care of. And then we get money from the state and from the government. And so it's just a very, very complicated process.
It is.
And the foundation can help kind of mitigate some of those barriers to funding passion projects.
Yes.
Growing education.
Yes. I would be remiss if I also don't mention that a big part of philanthropy in healthcare also revolves around what we call the social determinants of health. So as the philanthropic arm of the hospital, I work in collaboration with colleagues here in the hospital, but as well as colleagues in the community around addressing factors that affect a person's health, such as nutrition. So if you don't have the financial resources for the types of foods that you need to be eating for your health condition, that would be something that's a big barrier. If you don't have access to transportation, you can't get to your doctor's appointments and you can't get to the grocery store potentially. Social determinants of health such as housing, transportation, nutrition, food insecurities are all factors that we also work with our community on in ways to problem solve and collaborate. Doesn't mean we're going to pay for all those things, but our work is really designed around how we bring people together to get to have an action plan to address those problems, and then a process that involves evaluating those actions and how to improve upon those actions. So philanthropy has grown and expanded, and then in some ways all we're doing is just cycling back to the very beginning. People give money when they know what the money is for, and you hold people accountable. That's what is in all efforts, whether we're addressing transportation needs for our clients or personal care needs for our patients. We're trying to use the resources to the very best of our ability and be transparent about it.
And I'm glad you touched on the social determinants of health because they really do affect what happens here at the hospital. You know, if you have a chronic disease and you can't afford the proper food to manage that disease, because not all food is good food and not all food feeds the body appropriately. And so if you don't have access to those foods, you might end up in the emergency department because you're sick. And then that's a resource that, you know, it's probably an extra expense to you that you didn't account for. And then it's a resource of the hospital. So if in turn we can sort of help manage those concerns before they become an emergency, that it really helps the whole system.
There are people out there that may not know that our hospitals across the country are responsible for ascertaining and helping patients plan their discharge and or even their clinic visit. And they might not even be admitted to the hospital, but to do the follow-up. And if patients come in unnecessarily to our emergency room or into our clinic visits and their health is really, those conditions could have been prevented, we are responsible if we didn't plan with them appropriately. Asking someone, do you have a way to get to the doctor next Tuesday for your follow-up appointment? We ask that because we're good people, but we also ask that because we have to note in the record that we did that as a part of our discharge plan so that we're problem solving or helping people to problem solve themselves. By the way, I do want to be clear about that. You know, the old adage about you can give people the bread, but if you teach them how to make their own bread, or give a fish, but teach them to fish. Well, that's what we're here. That's what we're about at Kit Carson County Memorial Hospital, is empowering people to help themselves.
And sometimes, in the day-to-day operations of the hospital, we don't have the resources to help continue teaching those things. And so are you saying the foundation part of the mission is to help provide resources to continue
Yes.
that?
Yes. I work with my colleagues here to address those needs. Sometimes there are problems that I actually might know the answer to how to solve that problem. And other times, I know other resources and people that I can connect either the provider to, like the doctor or the nurse practitioner that's seeing the patient, or whatever person is identified as needing help, we can connect them with resources.
And that's why I think that personally you're an excellent choice for the director of the foundation, because you've been in our county for a long time and you have a lot of networking and resources, but also I know that your heart really is in caring for others and making sure that they can care for themselves. So I'm very excited for your role.
Thank you. Me too.
So if you could leave listeners with one key message about the foundation's impact or future, what would it be?
I want people to know that whatever way you want to express your gratitude and desire to see this hospital and our services continue to not just survive, but thrive, we can help you. We can help you figure out how you can contribute. And every contribution makes a difference, makes us a better, healthier place to be. I just want everyone to know that if you've got questions about how you can help, give me a ring.
I do have one more question. Can employees contribute to the foundation?
Oh, employees have already contributed to our foundation. Yes. And in fact, that is a big part of philanthropy also, is helping my colleagues understand and appreciate that giving back, whether it's financial or time, is really energizing. It gives people the energy and the passion to continue to do the good work that we pride ourselves in here at Carson County Memorial Hospital.
Awesome. So if an employee wants to contribute, they can just get a hold of you?
Yes, they can.
That's awesome.
Yep.
Well, thank you, Kindra, for joining us today and bringing us the news about the foundation. Again, I know it's a very complicated process, but I'm sure anybody that wants to contribute, all they need to do is get a hold of you and you will walk them through that process.
I absolutely will. There will also be information as plans are finalized on our website. So on the hospital website, we have a tab for foundation, and that is under development.
Yeah, so you can find that information at www.kccmhsd.org. And there is, under the About Us tab, another tab for the foundation. You can learn more about their mission, their vision, their board of trustees. You can also directly contact Kindra through that tab. And while you're on our website, just fish around and learn more about us, and maybe that will help make up your mind as whether you want to support the cause or not, which you will, because this is a great place. So anyway, thank you again for joining us on another episode of the KCCMH Connection. Don't forget, like, share, subscribe, and keep joining us back here weekly, or about every other week we're dropping the podcast. But if you have ideas or you want to be a guest, just get a hold of us. Anyway, enjoy this beautiful wintertime spring weather.
Yes. Thank you very much for having me.
Bye.